This is a contrast CT scan of a 55 years old female. She is a known case of carcinoma of left half of nasal cavity and left maxillary sinus. She was operated upon approximately 7 years ago. She remained asymptomatic, but now she has presented with epistaxis. Now this is the contrast enhanced coronal scan. Please see this mass lesion here. This has occupied whole of the left frontal sinus. Left frontal sinus is enlarged. Its infralateral wall is thinned and it expands into the supromedial part of left orbit. This represents the mucocele of left frontal sinus. It shows no enhancement with the contrast medium. Now I will show you the magnitude of surgery. There is no nasal septum, there is single nostril. Both inferior and middle trabinets, they are deficient. Now this is the residual part of the right maxillary sinus. On left side there is no residual maxillary sinus. Now this is the mass lesion growth which has recurred. It is occupying left half of nasal cavity and extends across the midline onto right side. This has eroded the posterolateral wall of left maxillary sinus and projects into the infratemporal fossa. Superiorly, it extends into the left ethmoidal sinus, and further posteriorly it extends into the left sphenoidal sinus, eroding its anterior wall. The intersinus septum is eroded and the mass extends onto right side as well to involve the right sphenoidal sinus. Now the cribriform plate is intact. On left side, lamina papyracea is deficient throughout. This represents the residual effects of previous surgery. On right side, lamina papyracea is visible at places. Now I will show you. This is the axial scan. Please observe, this is the left frontal sinus mass which represents the mucocele. It has expanded and enlarged the left frontal sinus. This is its lateral wall which is thin and it projects into the supromedial part of left orbit. Now this is the region of the sphenoidal sinuses. Its walls are eroded and expanded. Growth extends downwards into the ethmoidal sinus and further down into left half of the nasal cavity. The mass shows significant non-homogeneous enhancement contrary to the left frontal sinus mass, which represents mucocele and does not enhance. Now this is the bone window details. Please observe this mucocele occupying whole of the left frontal sinus, thinning and expanding its infralateral wall into supromedial part of left orbit. Now this is the mass here. At this level it has eroded the posterolateral wall of left maxillary sinus. Superiorly it is extending into the ethmoidal sinus. Please observe that left lamina papyracea is deficient throughout, while on right side it is visible at places. Cribriform plate is intact. Anterior wall of left sphenoidal sinus is eroded and the mass extends into the left sphenoidal sinus and furthermore into the right side. Posteriorly, the mass extends into posterior nares. This is the axial scan, just to show you the bone details. Eroded median and lateral walls of left Sphenoidal sinus, mass extends downwards. The mass has eroded body of left pterygoid. It projects into the left pterygomaxillary fissure, but there is no extension of mass into pterygopalatine fossa. Now please observe pterygomaxillary fissure on right side. This one here and this one here. And mass extends downwards into the nasal cavity. So there is recurrence of the growth and its extension into the left ethmoidal sinus and both sphenoidal sinuses.